Welcome to the Menopause Hour, your go-to source for empowering answers to your burning menopause questions, the ones you won't get from your OBGYN. Brought to you by Winona, menopause care made easy, and hosted by our experts, CMO Dr. Michael Green and Medical Director Dr. Kat Brown.
Hi, everyone. Welcome to our live Q&A event today. We're doing our doctor dialogue, how HRT supports skin health. And I know that I'm so excited for this conversation that we're going to have tonight. And it looks like we have more and more people just about every second, which is super exciting. There's already 50 of you all here, which is so great to see so many faces and people kind of showing up today. And I know that these conversations are really helpful and really great across the board. So thank you all again so much for being here. And, you know, I kind of think for like one of our first things, we have obviously some really great people on this call. So I'll go ahead and let them give a little introduction of themselves and who they are. Who are these people that are going to be answering your questions? And they can give a little bit of that. And then I know that Joe wants to say a little something as well. So I will go ahead and pass the mic over to Dr. Green if he wants to start, and then we can kind of go around and we'll jump all in there.
Great. So hi, my name's Mike Green. I am an OBGYN. I'm an MD. I am the Chief Medical Officer of Winona and super excited to be here. I have learned a ridiculous amount from Jo. She is our skincare expert, and I'm sure I'll learn some more tonight. We're really here to answer your questions. So if you could please start typing them in the chat section. Don't type them in the question section. Type them in the chat section. Otherwise, you're going to just hear us chit-chatting with each other. So go ahead and start putting your questions in now, and we'll get to them. So a little bit about myself. I am, like I said, an OBGYN. I finished residency in '99, so 25 years. I've been doing this for a little while. And I've been with Winona since the beginning, and super excited to be taking care of y'all. Women's health has been my passion for over 25 years, so it's great to continue that. And the whole skin thing is, I know, super important, and we're really, really excited about our skincare product. It's really an amazing thing. I'll tell you a little story about my wife after Jo does her spiel. But I think I'll pass it off to Dr. Kat.
Hi, everyone. I'm Dr. Kat Brown. I'm also a board-certified OBGYN, and I'm medical director at Winona. I've been with Winona now for 4 years. Graduated my residency a little later than Dr. Green, 2008, but have devoted my career to women's health. And really much of our careers in OBGYN is really focused on the OB part and a lot of the delivering babies part for much of our early careers. But it wasn't until I started going through my own perimenopause journey that I started educating myself more and more. You know, we're seeing a lot out in the media now about how a lot of OBGYNs and doctors in general are not trained very well in menopause. And so a lot of us have been, having this inner force of self-study where we've been learning as much as we can and doing as much as we can to help our patients more. And that's kind of where I'm at as well. I'm in the Philadelphia area, in the suburbs there, but take care of many of our patients across several states. And it's my mission to educate and to really make sure that every patient out there, every woman, learns as much as she can about her own body and about this whole process so that she can empower herself to live the best life that she can, to make sure that, that we make the last third of our lives better than the first 2/3 or the last half, I guess, depending on how long you want to live. And then I'll pass it on to Jo, who's our skincare expert extraordinaire.
Oh, thank you. How long we want to live? That's a great question. Well, now I'm going to laugh and I won't be able to stop. My name is Jo. I'm actually a dermatology nurse practitioner by trade. But I am also a patient of Winona. I was a patient first and foremost, and actually stumbled across an opportunity with them to join them, not as a nurse practitioner, just low key behind the scenes kind of thing. And it is since evolved since 2.5 years ago. I'm head of patient care services as well. So all of the what we call customer service, I lead that team. But skincare has always been my passion. I was a dermatology nurse practitioner for almost 12 years before I stepped away and decided I just wanted to chill out. But here I am, and I'm very excited to be with Winona, one for the HRT piece. That's the most amazing piece. But the fact that we have now added a skincare product to the line is truly amazing. I was very excited about it simply because I'm devoted to skincare. I always have been. And we got together with the pharmacy team. They're an amazing group of people that really know how. In fact, when I sat in on the meeting where we talked about bringing this product together and how we were going to combine certain elements and what elements we couldn't combine because it just wasn't going to work, was fascinating to me. But we came up with what I think is a fabulous product. And I'm here to tell you, I'm super picky. I'm always skeptical of skincare products because they're a dime a dozen, right? They're out there. There's tons of them. But we have actually, I guess I had something to do with it. I had a little bit of input, but the pharmacy team that actually got the ingredients and compounded a couple different options for us that we tried before we came up with the final one. And I think it's fabulous. It's a lovely, what we call very cosmetically elegant product that has two powerhouse ingredients, the estriol, which if you're in any phase of the menopause transition, you need. And then we paired that with some tretinoin, and everybody really can use some tretinoin. You don't have to be in any stage of menopause to benefit from tretinoin. So I guess we'll get to some questions, and then I'm happy to answer all of those. But I'm excited about the product. I love it. I use it. I think it's fantastic.
I just started using it as well. I mean, before we get into the questions, you said a very elegant product. That's a very good way to put it. I would say like it feels luxurious when you put it on your skin. It's like very, very silky.
Yes.
Unlike any other face cream I've ever used, which I really like that part of it.
Yep.
That's so great. I love your all's experiences with that as well. And that was so cool, Joe, as well, to hear about you like sitting in that meeting and getting to be a part of that. I love that as well.
Right.
I think that's so great too about Winona is how much the team gets to be involved as well about the things that they care about, which I think is such a great part. And so kind of just to jump into some of these questions that we have going as well, which it seems like we've already got quite a list. So we'll jump right into those, which will be exciting. So our first one tonight is from Enza, and she says, hi, how do I deal with this extremely annoying itching all over my body since I've started menopause?
Well, I mean, itching can be one of the side effects, like one of the early symptoms that like some women will notice changes to the quality and the texture of their skin as they go into perimenopause and menopause. So I'm guessing maybe Enza's not on therapy yet, or maybe hasn't started hormone therapy if you're noticing this. That would be my guess, just because it's a common complaint I get from patients. That they notice their skin being very dry. Sometimes some women can get a sensation like something's crawling on their skin, or itching, something like that. So estrogen therapy would definitely help that.
It's a great answer. I think that's really helpful. And then I think jumping next to Kristen has another question. And she says she has coarse chin hair patches, dry skin growing all over them, causing infected hairs. Help. So I would love to hear a little bit about maybe what one of you all would suggest in that case.
I can answer this. So there's a couple things to this. Obviously, as we get into the menopause transition, our skin gets drier. We don't hold on to moisture like we did when we were younger. Unfortunately, that's one of the things, and that's associated with the loss of estrogen. So as your skin gets more dry, the hair piece, in terms of causing infected hairs, what happens is that I'm trying to like go off on a separate thing here. You start to grow some hairs where you didn't want to. That's just part of the deal. But then you pair that with dry skin. And if you think about dry skin versus supple skin, when there's hairs that are trying to make their way through the skin surface, when the skin is supple, they come through. They pop up. You may not like the fact that they pop up and they show themselves, but it beats the alternative where when the skin is dry and that hair tries to come through and the skin is dry, it can tend to kind of curl under and you can get like an ingrown hair. So a couple things: keep the skin moisturized. Second thing, don't pluck the hairs, as tempting as it may be, because when you pluck that hair and the skin is like this, if you will, and the hair can come through like that, you pluck out the hair and then the skin closes. And so by the time that follicle regenerates a new hair and it makes its way to the surface, it's like, the door is closed, and then it'll just curl under. So a couple things: don't pluck, and then keep the skin moisturized. But that's also where that's a great segue to where this face cream comes into play, because it helps to turn over the skin cells and it also helps to moisturize the skin. The estriol helps with the hydration piece. The tretinoin helps with that skin cell turnover. So when you've got like a dry layer of skin, that makes it harder for those hairs to come through and are more likely to get kind of curled up underneath and cause a problem. So there's a couple things that you can do.
Thank you so much, Joe, for that answer. That was great. I think another question we have from Katie. Katie asks, how high is the risk to develop acne with progesterone? If this happens, what can be done to minimize it and stay on HRT?
It
I
really
don't know if I'd say progesterone is really the culprit in this. Go ahead, Mike.
it takes a lot of progesterone to cause acne. So, for instance, Depo-Provera, which is a progesterone injection that we use for birth control. Well, I don't use it for birth control because I think it's a lousy birth control, but that some people use for birth control can cause acne, but it's like giant mega doses of progesterone. The amount of progesterone that we use in HRT is really pretty minimal, and I think it would be extremely unlikely to see that side effect with HRT doses of progesterone. So acne can be a symptom of the menopause transition. And as we've sort of already somewhat talked about, the estrogen in the HRT can help with that. So I think it's unlikely that you're going to get the side effect from progesterone. We can always minimize progesterone, and sometimes changing, if you're using an oral progesterone, to the cream can be helpful as well. And so I think I think it's an unlikely thing that'll happen, and if it does, that would be kind of go with the lower dose progesterone and using the cream version probably be a way to minimize it further. By the way, I didn't get to tell the story about my wife.
Oh yeah, tell the story.
My wife's been using the estriol with tretinoin cream as well, and she was on a tretinoin cream before, so the estriol was sort of the new thing. And so there's kind of two pieces of the story. The first is that, okay, we've been married for 36 years now, and I'm not the most attentive person in the world as the typical husband, but I actually noticed, I'm like, man, your skin looks amazing. And I'm not the person that usually knows this stuff. But here's the big one. She went to some girls' night at our neighbor's house, and as soon as she walked in, everyone's like, you had work done. And she had not had work done. And in fact, so much so that one of the ladies insisted on touching her face to feel for like the fillers that they swore she had. But no, all she had was our amazing cream. So that's, I think, one of the best things I've heard, and that's actually absolutely a true story.
That's such a fun story, Dr. Green. Thanks for sharing that with us.
It's a lot cheaper than work, too.
Absolutely. Looks like we have another question from Gina. She has a question. She says, I'm 57 currently, and I was reading after 60, don't need HRT anymore. Is that true?
That is not true. So you're getting confused in that. HRT is super safe, but we know that if we start it for the first time in a woman that's over 60, it can increase risks of cardiovascular issues. And so typically we don't start it for the first time in people over 60. However, if you've already been on it it's safe to continue past 60. So that's where that magic 60 number comes from. So if you're 57 and you're on HRT, you can continue it for as long as it's helping, and it's very, very safe. It's just that we don't start it for the first time after 60, but it can be really beneficial. There's been some articles out recently advocating for keeping people on HRT into their 80s. So it's a little extreme. It's certainly, safe. It's something that people are talking about now. Is not sort of what we normally do, but certainly 60 is not a number where you need to or even would necessarily want to stop it.
Absolutely. And jumping a little bit back to kind of the skin conversation we were having as well, Becky would like to know if it helps with tightening neck skin at all.
So are you asking about our face cream?
I think that she's interested on both sides. I think both face cream and then also the HRT.
Okay. Well, I can answer the face cream part. I wouldn't go so far to say that it's a tightening agent. But will you see improvement in the quality of your skin on your neck? Absolutely. However, there's a tiny little caveat to the neck and the chest. For whatever reason, those areas are much more sensitive to the tretinoin, not the estriol that's in the cream, but the tretinoin. It's an irritant. It's going to facilitate skin cell turnover. So it's going to create some irritation. Anytime we do any sort of procedures on the face, the neck, and the décolleté, you will always see more irritation on the neck and the chest versus the face, for the most part, for most people. So you just know that using that product, you may notice a little more irritation in the neck and chest area. So that what that means is you just want to use a little bit less. And in terms of using it, in terms of like how frequently you use it, you want to go low and slow. Take your time. There's no rush to use it every night. That's what's recommended, is that people use the product 7 nights a week. Some people can never get there. They're ultra sensitive and they can't get there. But with the neck and the chest, you can absolutely use it in those areas, and you will see improvement in that skin, the health and quality of that skin. But I can't go as far to say that you will see tightening per se, like you would with a laser treatment and whatnot. But here's the thing. If you're ever considering any sort of, it's kind of going offside here, but if you're ever considering any sort of treatment outside of that, using a product like this to get the health of your skin in tip-top shape is essential. A lot of people want to go and pay money to have procedures, but they don't want to take care of their skin before or after. They just want to do the thing and get the fix. And I'm here to tell you the best thing that you can do is to use a quality product that will improve the health of your skin, and then get a procedure if you needed that kind of thing done, and then continue that afterwards. Some procedures you do need to stop the tretinoin for. There's no indication to stop the estriol, but it's a combined product, so you would have to stop it all together. So if you decide to go and see somebody in the aesthetics world to get our procedure, please let them know that you are using that product. Typically, they will have you stop it for some period of time, depending on the procedure, because it can create some more sensitivity and irritation.
That's great, Joe. Thank you so much for, thank you for jumping on that side of the question. And then to Dr. Green, Dr. Kat, as far as on HRT helping with neck tightening, how does that work on that end?
I mean, I think that overall it helps with the quality and the texture of the skin, but yeah, it's not going to reverse the aging process. And I think that's really a function. I mean, most of the time when there's loose skin, women can see that when they've lost weight, but also just aging. Sometimes we see that as well. So unfortunately, it's not a magic cure for that.
Perfect. Thanks so much for that answer. And then we have a question from PJ. And she's wondering, she says, since starting perimenopause, my skin has changed. It's incredibly dry. I have sebaceous filaments, whiteheads, and blackheads. Will topical estrogen help with that?
I'll take that one.
Yeah, I think this is another one for our face cream, Joe.
Yeah, definitely. I thought I saw her question on here too. So dryness, obviously the estriol component is going to help with the hydration piece. In terms of like sebaceous type things, blackheads, whiteheads, tretinoin actually is used very widely in the dermatology world for acne. And that's whiteheads and blackheads and that kind of thing. It's a mainstay for acne treatment. So yes, the short answer is that this product will, over time, help to remove some of those blackheads and whiteheads and some of the sebaceous things that you have going on.
Perfect. Thank you so much, Joe. We have a question from Yvonne next, and she says, I'm interested in HRT, especially for my skin and hair health. My mom did HRT in the late 80s and early 90s and was told it was the reason she needed bypass surgery. Can you talk about the risks of HRT, especially around heart disease?
I don't know if I would have blamed HRT for someone needing a heart bypass, but
I know I wouldn't. Well,
right. I mean, that's okay.
So here's the thing. HRT, if started before 60 in an appropriate patient, decreases the risk of heart disease. So it actually treats that. Now, back in the 80s and 90s, we didn't have the same understanding that we have now. But there was actually a big landmark paper came out 2 or 3 years ago by the cardiology world, basically saying HRT is like one of the best things for your heart when you're in perimenopause. And women should start this early in the menopause transition. So HRT actually protects your heart and improves heart health. Now, that's assuming that you're an appropriate candidate for it, obviously, sort of as we were talking about. But yeah, this is the opposite of what you're thinking. This is actually one of the best things you can do for your heart.
Thank you so much for that. Yeah, Dr. Green, on that answer. We have another question from Becky. And she is wondering, she said, since she's had COVID, she feels like her HRT might not be working the same. Is this probable, or is there something else maybe going on?
Well, I think while you're actually sick, especially for women, if you are fighting a current infection, whether or not you recently got infected with COVID, or if you get a flu or a cold, anything that adds a lot of stress on your system is going to make your menopause symptoms worse. Your hot flashes may get exacerbated. Your night sweats may get worse because you're fighting an infection. Your immune system is activated. And so you're no longer in a normal environment. So I don't think we could really gauge like how effective your treatment is. In fact, I've had some patients pause on their treatment while they're really sick and then resume when they feel better, just because it's like one more thing on top of taking cold medicine and everything else. But I don't know if she's alluding to like a long time from her COVID. It's hard to know without more details in the question.
Okay, thank you for that. Jasmine is wondering, would we ever consider developing a gel version of the estrogen and tretinoin product? She says she's acne prone and some of the ingredients, specifically the sweet almond oil, might make her break out.
Not sure that I can 100% answer that, but there's different people, and trying to capture and take care of everyone with one product can be a challenge. It's not going to be a fit for everyone, but it's a good fit for a lot of people. There can be some ingredients in the product that can exacerbate some acne. I don't know if Winona has in the pipeline to develop a gel base with tretinoin. I will tell you is a tough pairing, because gel based products are drying by and large. They're usually alcohol based, and so when you take something that's alcohol based and drying and then pair it as a tretinoin, and there are some out there, I'm not going to say that they're not, there are products out there, but most of them are lotions and creams because of the dryness of the tretinoin. You're kind of getting a double whammy on the dryness issue. And a lot of times actually acne is exacerbated by a more dry environment. So I don't know if you've actually tried the product. It might be worth it. I know that you mentioned the sweet almond oil. I mean, if you know that you have an issue with that, you probably want to avoid it. But you might be pleasantly surprised that your skin actually likes the hydration, and that will slow the oil production, which is typically the culprit for acne.
That's great.
I can answer the in the pipeline now. I'll be honest with you. We first started having a conversation about this cream before we launched Winona. So that's like, what, 4.5 years ago. This has been in the process for a long time. And then the amount of back and forth and trying different stuff. How long do you think that was, Joe? 6, 9 months, a year maybe? I mean, a lot of work and effort went into developing this thing. I don't know that there's at least right now, I don't know there's the energy to do that again right this minute. So if not in the pipeline, who knows what the future holds, but just to be honest, probably not anytime soon.
We have another face cream question. Amy is wondering, what is the percentage of retinol in the face cream?
We actually have 2 different formulations of the tretinoin. There's a lower dose at 0.04%. I think now that you're asking me, I'm like,
25.
And then 0.025 and then 0.4%. The 0.025 is for most of the time when you get that prescribed at dermatology and whatnot, that's like the lowest formulation. And that's where most people will want to start. If you've never used a tretinoin product before, that's definitely where you want to start, because your face needs to acclimate to the product. And there can be some irritation when you're talking about turning over skin cells and speeding that process up. There can be some redness, there can be some flaking, there can be some irritation, there can be some dryness. So that lower strength, most people can tolerate that quite nicely and gradually improve or increase their the use of it. Again, the goal is 7 nights a week. That's where you're going to get the max benefit. But sometimes it can take quite a while to get there. I'm ultra sensitive. I have underlying rosacea. You probably can't tell that because it's very well controlled. But with products that can create irritation, I have to take it very slowly and very carefully. So that's exactly where I started. I started at the lowest dose. So say, for example, you're using the lowest dose and you've been on it for at least 30 days every night, and you're not getting the redness, the dryness, the irritation, the flaking, then it is time to move up to the next dose and get a little more bang for your buck.
That's great, Joe. Sorry, go ahead, Dr.
Make sure you message your doctor if you want to move up, so that we can make sure we get you the right refill.
Because you all start, everybody, unless otherwise specified, start at the lowest dose, and then we'll go up from there.
Basic philosophy, we don't want to hurt anybody.
Right.
So better to start low and go slow, and rather than give somebody side effects. But if you move up, you need to let us know so we can arrange that for you.
Yeah, I mean, but if you've been on a tretinoin product before, say you've been on the 0.025 from your dermatologist for a long time and you're doing really well, you're not getting irritation, you could have that conversation with your Winona doctor and say, hey, I've been on this. Would it be better for me to start there or start at the next level? I mean, my personal opinion is that I would probably say yes, you could probably bump up to that, but it certainly wouldn't hurt to do the first bottle at the lower dose and then the subsequent bottle, because it's something you want to stay on for a long time. It's not something that it's one and done. You start on it and you stay on it forever.
Absolutely. And just to bounce off of what you were saying a little bit as well, we have another question kind of about some of that dryness and mild irritation that might kind of show up at first. Is there a way that Erin's wondering that she can, well, if this happens, help combat that? And how long might it last before her skin kind of gets accustomed to that product? And I know that you chatted a little bit about like what that looks like to move up incrementally, but is there anything else kind of on that side that might be helpful?
Well, there's two parts to that. There's the one sort of preventing it to some extent. Some of it you can't prevent because it's just going to happen. It just depends on how your skin responds. But the other skincare products that you use do impact how this product affects you. So for example, if you're using a cleanser that's a foamy cleanser or a gel cleanser, a lot of people with acne use a gel-based cleanser. Those can be kind of drying. So you might want to consider using something that's more along the lines of a creamy cleanser. The foamy cleansers are a dime a dozen out there. They're all over the place, but they can be drying. I can't use a foamy cleanser. I use a creamy cleanser every single day because I'm in menopause and I need that extra hydration. I also have rosacea, so I'm a little more sensitive, that creamy cleanser. The other piece to that is the moisturizing piece, using a moisturizer that, and some people don't actually, some people don't use a moisturizer, but using a good hydrating moisturizer will help to combat that. What was the second part? I thought I was going to remember it and I didn't.
I think it's important too. Like when I first started using our face cream, I had to go and scrutinize every bottle of every skincare product that I had because you really have to avoid any other irritating products while you're using this, because literally I went to go put something on my face that I thought was a gentle cleanser and it burned. And I was like looking at the ingredients list and I'm like, oh, it had salicylic acid in it. I had no idea.
Yes.
So a lot of these products that are out there that you may have been using for years may have other irritants in them. So you really need to kind of purge that when you're starting a tretinoin, I think, which is really important.
Yeah. I see the second part of her question now, like how long does it last? It varies from person to person. Again, the recommendation is to start low and slow. So for some people that will be like when you first get it, use it 2 nights a week. And then the next week you may increase to 3 nights a week. And depending on how much redness and irritation and dryness, you may scale up from there. But if you start to get a bunch of redness and dryness and irritation, then just stay where you are. If it's unbearable, then you want to step back and you just go low and slow. Again, it varies from person to person. Some people can just start using it every night and they have no problems. They don't get any redness. I don't really know how that happens, but I suspect they probably haven't used any products like that. And so they're not as sensitive to it as some others, but yeah, it varies from person to person, but hang with it is my advice. Just stick with it. That's one of the things that people do. They start to get that redness and the irritation and the flaking, particularly kind of around their mouth and their chin area. And they're like, oh, I don't want that. But just you don't need a lot. A little goes a long way. And just take it low and slow. I mean, literally, if it's once a week for a few weeks, and then you do twice a week for a few weeks, the tube's going to last you longer. So there's that. But you will eventually get there. Your skin and will eventually acclimate to it. There is an end in sight, even though you may not be able to see that initially.
Absolutely.
Can you also talk about too, Joe? I remember you telling us, because Joe actually did a training session with our doctors to kind of help give us some advice on how to counsel patients, because some of us have varying experience with derm and treating skin disorders and things. But I know you also recommended making sure patients are using a good sunscreen too, especially when they have sun exposure,
Yes.
Which is important for aging skin, but also when you're using a product like this too, right?
Right, exactly. So if you think about it, you definitely, a couple things. Let's address a couple things. You want to use this product at night, okay? That it's intended to like repair and restore your skin, and we do that while we sleep. That's why we go to sleep, is for our body to repair and restore itself. So it makes sense that we use a product like that. This is not a protective product. It is a corrective product. So correctives at night, protectives during the day. So that's the first piece. But yes, you definitely want to use Dr. Green, sunscreen when you're using the product.
That sounds like an inside joke.
I had to. I'm sorry, I couldn't help myself. I'm going to get him one day. You really want to use a sunscreen, because if you think about this is going to sound kind of crazy, but if you're not using a product that's turning over skin cells, you've got lots of layers of dead skin cells on the top. This is really just a protective layer. That's all it is. There's all the goodness happens in the deeper layers of the skin. But when you have lots of dead skin cells, they actually kind of protect you from all the things that you encounter, which is not good. So you want to get rid of them. So when you do, then you are kind of leaving your face exposed. And yes, when you're using a product like this, you are more likely to burn. So you want to use a sunscreen. My recommendation is to use a broad spectrum mineral-based sunscreen. I'm not a super fan of the chemical-based sunscreens. I could go on, we could talk for another hour about that, but I won't go off on that. But a broad spectrum mineral-based sunscreen. And there's some lovely ones out there, Dr. Green, that don't smell like sunscreen. They don't feel like sunscreen. And they don't leave you looking like Casper the Ghost, but it protects you because sun is actually the biggest thing that will age you, not menopause. It's not there. It's the sun, exposure to the sun. But yeah, you definitely want to protect your skin when you're using this product. I have some people that will say, well, I'm not going to use it during the summer because I'm going to go on the boat and I'm going to do all the things. Like I said, you should use it all the time, forever and ever and ever, until you just don't want to use it anymore. But using a sunscreen to protect your skin so that you don't burn is ideal, and it won't kill you to use a sunscreen.
Absolutely. I love that note on sunscreen. We're all going to go out and buy it now for sure if we don't already have it, which is great. We have two questions from two separate patients about Hashimoto's, and Jody is wondering, does taking DHEA in the morning affect her thyroid hormone that she also takes in the morning? They're about 2 hours apart, those two medications.
It should not. No.
Perfect.
I mean, from what I remember, and Dr. Green was formerly in family practice too, so he might be able to chime in, but from what I remember with thyroid medication, don't take it with milk because the calcium and vitamin D can interfere with your absorption of the thyroid hormone. But other than that, there's not a lot of other medications that would interfere with that.
Yeah, the DHA and the estrogen and progesterone should not affect your thyroid hormone. Now, there is a little caveat to that, in that thyroid is a very fickle medication, which is why your doctor's probably checking your levels every now and then. Just out of nowhere, all of a sudden it'll be off for no particular reason. And so kind of anything you do can, in theory, affect your thyroid. But there's really no direct reason that either DHEA or the estrogen or progesterone should affect your thyroid levels. Doesn't mean you don't need to follow the levels, because you do whether you're on them or not. But it really should not affect them. And certainly the timing won't matter either. So you don't have to separate them like you're doing. You can take them together if you want. If you feel more comfortable separating by a couple hours, that won't hurt either. But if it's easier to just take them together, that's fine as well.
Perfect. That's
I have a
great.
little cold, so I apologize for my voice.
We can hear you fine. We have one more question, kind of on a similar track as well. And this one is from Melanie. But she is wondering, has signed up to receive DHEA, but she recently saw that there's rice flour in it. This often causes a flare up for her, as she has that Hashimoto's as well. So she's willing to give it a try if she can discontinue, if she has a reaction. But she was hoping to get your thoughts on if reactions like this tend to be different when taken in medication form.
So she reacts to rice normally?
Rice flour,
and is
yes.
worried about rice flour in the medication.
Correct.
I haven't had that unique situation with a patient. So, I mean, I guess the only way to know would be for you to try the medication. In my mind, when we're putting ingredients like that into like a pill form or a supplement, it should be a negligible amount. You know, normally we're using those as kind of an inert substance to help as a vehicle for the medication itself. So it's not like eating a big bowl of rice flour, you know. So I'm hoping in that sense that you'd tolerate it better. But let us know.
I haven't seen problems, but you know, everyone's unique. But that would be very unusual.
We have a question next from Teresa, and she's wondering, speaking of the face cream, but are there any risk of increased risks of blood clots or breast cancer that come with using the face cream?
Not at all. Not at all. I mean, we generally say there is no systemic absorption. It's negligible. It's just the one estrogen. It doesn't impact any other HRT that the doctors would prescribe. They don't have to take into account, like with some other things, how much they're going to prescribe in terms of the dosing. It's, I guess my straight answer is it's a non-issue.
Absolutely. Our next question is from Brandy, and she's wondering, she says, my neck and chest area have a different texture than the rest of my body, and they seem to be red all the time. So I think she's wondering, what might be causing this? What if there's a good way to kind of move forward from that? I think is where she's coming from with that question.
I would say it's hard for us to know without being able to examine you, like just hearing your description of something. If you haven't had it evaluated, I would strongly encourage you to see a dermatologist since they are the skin experts, and just have it evaluated, because just having the discussion, it's hard to know. Like, it could be a variety of things. It could be a contact dermatitis, or it could be a rosacea like we had talked about earlier. But yeah, you really need to have somebody eyeball it.
We have another DHEA question. Keisha says, if DHEA helps boost testosterone, just lost that one real quick. Sorry about that. There it is. If it helps boost testosterone without blood work, how will I know if the testosterone is increasing?
Really by the way that your symptoms respond is really, so we don't recommend any blood work when it comes to starting HRT of any kind. And this is unlike a lot of what maybe many of you have heard, because there are a lot of places out there that'll make you do blood work or make you do urine hormone testing and things like that to try to guide your treatment. Symptoms alone, and especially a symptom log or a symptom diary, is all we need to figure out what it is the best way to treat you. And then the way that we gauge whether or not those hormones are improving is by whether or not your symptoms are responding to the medication and whether or not you're feeling better. So it makes it a lot easier, a lot less intensive on the patients to not have to keep getting stuck all the time. I just had a patient the other day that was having to go to a doctor every 3 months and get blood work and adjust levels before getting pellets inserted. And it just sounds like it's such a painful way to get therapy. It's just not necessary.
So I want to jump on that as well. If you're getting testosterone pellets or using testosterone shots or testosterone gel, you kind of do need to check your testosterone levels. And the reason is testosterone has a what's called a narrow therapeutic index, which means that the difference between the level you want to be successful and the level it takes to cause side effects is really pretty close. And so it's very easy with direct testosterone therapy to push you into badness. And there's some really bad things that can happen if you have too much testosterone. So, acne, increased facial hair growth, male pattern baldness. There's some even worse things that can be irreversible, like voice deepening or even clitoromegaly if it really gets out of control. And so if you're getting testosterone pellets or injections, that needs to be watched. The nice thing about DHEA at 25 to 50 milligrams, it's enough to get your testosterone into normal female levels, but it's not going to be enough to kick it into those dangerous areas that can cause badness for you. Now, DHEA is a performance enhancing drug. And I can tell you, I have friends in the gym that use these massive doses of DHEA to really push their testosterone. So yeah, you're using 200 to 400 milligrams of DHEA a day. That's a whole different story. But at 25 to 50 milligrams, it's extremely safe. And we don't have to follow levels because we know we're not going to get you into overdose or a toxic range. But it's enough to get your testosterone up to sort of a normal female level and start giving you those benefits that you're missing out on because your ovaries aren't producing them like they were when you were 20. So that's one of the really nice things about DHEA.
That's a great answer, you all. We do have another question from Latina. And she has a question. She says, after taking HRT and DHEA for 2 weeks, 3 days ago, she started waking up at 4 a.m., feeling anxious and not able to go back to sleep. Does this mean that she needs to adjust either her HRT or her DHEA? And she says that she takes her HRT at 9:30 p.m. and then she goes to bed at 10.
I wouldn't change your dose this early in if you're only 2 weeks into treatment. Actually, my recommendation as your doctor would be to experiment with the time of day that you're taking the medication. That would be my first step. So, generally a lot of patients like to take the estrogen progesterone component at night because it can help some women with sleep. But for some women, they can get energized by taking hormones. And so it actually could be making your sleep less restful, or it could be, that you're not getting restorative sleep. So I would usually encourage patients to experiment with using it during the day or in the morning even, and just try that for a few nights and or a few days and see if it makes a difference.
Absolutely. Looks like we have a few more questions about the face cream as well that we've had come through. We have one from Lynette, and she says she's wanting to ask about being able to use her Winona estriol and tretinoin in her nighttime routine alongside her anti-pigment cream, which contains the active ingredient. Joe, you can tell me if I'm pronouncing this right, but it's thiamidol. And she's wondering if it's okay to use both these at the same time.
Yeah, as far as I know, that that product is not an irritant. Most of the things you want to stay away from are like glycolic acids, alpha hydroxy acids, other over-the-counter retinols. Those are irritant products. That is not an irritant product. You shouldn't have a problem. What I can't tell you though is in terms of layering. I don't know if you're using that all over or if you're spot treating with that, because I believe is for dark discolorations and things like that. Not used very, very often, but if you're just spot treating, what I probably would do is spot treat that area and then follow with all over with your face cream. You shouldn't have any problems with those two.
Absolutely. And one more question that we have from Barbara, along the same lines, so a little different. She's wondering if it's okay to mix like a pea-sized amount of her face cream with a gentle calendula moisturizer and then spreading that over her face. Is that okay to use the cream in that way?
Yes, you absolutely can. And some people will need to do that. I can't speak specifically about that, but the fact that it has gentle in it, I like that. And it's probably okay. Some people will need to follow with a moisturizer to help just add in that extra hydration, particularly the people that are experiencing excessive dryness or redness or kind of flakiness. You can totally do that. Apply the face cream, our face cream, let that just sit and dry for a moment, and then you can follow with a gentle hydrating moisturizer. And I always say, I don't know about this moisturizer. And what I have always said to patients when I've seen them in clinic is just try it. And then if you start to notice excessive irritation, there could be an ingredient in that product, even though it says gentle, there could be a product in there that may be creating a problem. There's all kinds of gentle products that have minimal ingredients that typically pair well with tretinoin. I'm not going to name any brands. We have some listed actually in our Help Center article that are very gentle, low key, not a lot of weird ingredients in them. So, but you should be fine.
Absolutely. And kind of on that stream of topic as well, talking about kind of our help articles that we have. I know that we have a few people kind of in the comments that are just wondering if there's any specific kinds of moisturizers that we might recommend that would go well with the face cream in that way. Is that a good place to find some of those recommendations? Do you have any, or what's the best place for them to find those?
Yes, they are there. And then also the doctors, when they prescribe the medication, part of the information that they send you gives you some little tips and tricks about that as well. So, yeah.
Perfect. We also have a question from Tisha talking about HRT, and she's wondering whether it helps with vaginal dryness.
With HRT, yes. So typically restoring estrogen to your body and giving you estrogen therapy, vaginal dryness is one of the symptoms that it addresses. Now, I've had some patients that maybe really have significant vaginal dryness to the point where it's affecting their sex life, their day-to-day life. We also sometimes in those cases will also recommend vaginal estrogen as an adjunct because it helps more directly and a little bit more, putting the cream and putting estrogen right on the source sometimes can help with those symptoms a little faster than the systemic estrogen. So, if that's something that's a significant issue for you, you can talk to your Winona doctor about it, and we can talk to you about the risks and benefits of adding the vaginal estrogen as well.
Absolutely. We also have a question from Kim, also HRT. And she says that she's read that some women start spotting or bleeding when they start HRT. She says that she had a partial hysterectomy a few years ago, and that she's just starting HRT, and she's wondering whether it's possible that bleeding might occur to her.
So partial hysterectomy, so we have to define as your doctor what you mean by that, because it's not a medical term we use. The word hysterectomy typically means removal of the uterus. So if you've had your uterus and your cervix removed, then there's really no source of bleeding to be had. So occasionally I've had patients who have what we call a supracervical hysterectomy, where they take the uterus, but they leave the cervix. And it's not like there's a roadmap. There's not like a dotted line for the doctors to cut across to know where the cervix ends and the uterus begins. So inevitably, there can be some endometrial lining, which is where that glandular tissue that creates our menstrual blood lives, is in that uterine lining. And so in those senses where someone has a cervix left behind, they could still have some endometrium that could be reactivated with the hormone. And so they could potentially have some bleeding if they still have a cervix in place.
And we do have one other question along the lines of bleeding irregularly. Jasmine has a question where she says, I know Winona seems to favor the consistent dose of hormone regardless of if the patient gets regular menstrual cycles, while other practitioners recommend cycling the progesterone to mimic a natural cycle. Does it confuse our body to have a consistent dose of progesterone throughout the entire cycle? Or I've noticed I've been bleeding irregularly, and that she's about 6 weeks into the 50-50 period.
So I'm going to take this one because this is one of my pet peeves. So maybe 15 years ago, people started realizing that estrogen and progesterone together slightly increases the risk of breast cancer, but estrogen alone does not. So in women who have had hysterectomies and have estrogen-only HRT, do not have an increased risk of breast cancer, because it turns out estrogen doesn't cause breast cancer, which is, no one ever believes anybody when they say that, but that's what the data says. Turns out it's the progesterone that actually slightly increases the risk. Still, it's a really small amount, but because of that, there was sort of this reaction of, hey, maybe we should try to minimize the amount of progesterone we're exposing people to. And so it became in vogue to try different ways of using less progesterone. Cycling the progesterone kind of became popular. Some people went as far as to only give progesterone 14 days every 3 months to try to minimize it that way. And it sort of morphed into this thing of trying to make the cycles more natural, but that really wasn't the reason why it was done. So HRT doesn't do what birth control pills do. Birth control pills completely take over your hormone milieu. They shut the ovaries down so that you're not making hormone except for what we're giving you with birth control pills. That's how they keep you from getting pregnant, because the ovaries aren't cycling and making eggs. HRT doesn't do that. It's a much, much lower dose of hormone. And so the ovaries are still doing their thing. HRT just comes alongside and adds that extra little hormone that your ovaries are no longer producing. Guess what? Your ovaries aren't producing that hormone all 28 days of your cycle. And so you still need that hormone to be replaced every day, or at least it's beneficial for you. So anyway, that's kind of a long story, to make a long story long. It was actually, not a bad idea. Maybe we can minimize the progesterone exposure and we can give people benefit that way. So that, like I said, kind of went in vogue about 10, 15 years ago. Since then, data's come out, and what the data shows is actually it didn't really help. So it doesn't give you any improvement whatsoever, but it tends to cause more side effects. So people that take cyclic HRT, where they only take the progesterone 10 or 14 days out of the month, actually have more spotting and more bleeding side effects than women that take it every day. So there's no benefit to doing it cyclically. and there's only disadvantage. So there's no real reason to do it that way. Every once in a while, there are some kind of outlier cases where it can be helpful. I have a handful of patients that I do that with, but it's really for these sort of kind of unusual circumstances, and it's not typically the best way to do it. Is it wrong? Is it going to hurt you? No, it's safe to do it that way. It's just not the best way to do it. So that's why we promote continuous HRT, whether you're cycling or past cycling. The data is pretty clear that that's really the way, that's the best way for you, both in terms of benefit and decreasing side effects. It's pretty common to have your cycles kind of thrown off in the first couple of cycles when you start HRT. And so if you're 6 weeks in, it doesn't surprise me that you're having some irregular bleeding. That should correct itself by 3 months or so. If that continues beyond that, you really should let your Winona doctor know, and so we can help you with that. But in the first cycle or two, it's pretty normal to have some irregular bleeding, no matter how you're using it.
Thank you, Dr. Green. And we have another question as well. And I tend to see this question a lot in our women's groups. So I think this is great to touch on as well here. But we have a question from Lori. And she says that she's been on the 50/50 cream for about 18 months now. And while she rarely forgets to apply it at night, occasionally she does. And when she does, she's wondering, should I put it on in the morning or should I just wait until my regular time again that night?
I think if as soon as you remember that you forgot it, it would be okay to apply it if you wanted to go ahead and do that, especially if we're talking about 9 p.m. at night or like 8 o'clock in the morning. Doing it in the morning would be fine. Now, if it's the next afternoon and you'd normally be applying it again that evening, I wouldn't like double up on the dose and do it in the afternoon and then the evening again. I would just wait till the next dose in that situation.
And it looks like we have about time for maybe one or two questions, but we have one more on the face cream. And Cindy is wondering, does the tretinoin expire after being opened and how many months will it last?
Yeah, so it's a 90-day supply, and it technically expires at 90 days because that's when part of that formulation that I was telling you about earlier, they were talking about that and how we could make this last longer than, say 30 days. A 90-day supply is appropriate for trying to transition someone on there. So it expires technically in 90 days. Obviously, depending on how quickly you use it, you may wind up having it longer than 90 days, but what you may begin to see is that it will lose its efficacy. It's not harmful in any way, but it may not be as strong and as potent as it was, say, for example, on day one.
Absolutely. And it looks like we have one last question. So this was perfect timing as well on this last one, but we have one from Elizabeth, and she's just wondering, which this is a specific one, but can she use Bare Minerals foundation or just makeup in general when using the face cream?
Yes. Oh, absolutely. Yeah. Yeah. Actually, like a lot of Bare Minerals is a great line. A lot of like BB creams have sunscreen in them. It gives you sort of that coverage like a foundation, but also has an appropriate amount of sunscreen. And Bare Minerals, hence the name mineral, they use mineral-based products in there. So absolutely.
Awesome. Well, that looks like
there were a couple questions put in that question page, even though we didn't want people to.
Let me double check. There were one or two of those. We can definitely touch on those real quick. Lauren says, with the face cream, is the product suitable for under eye?
That's a very popular question. The short answer is yes, you can use it there, but keep in mind under the eye, right under your nose, around the corners of your mouth, you are more than likely to get more irritation in those areas. So although I don't recommend taking it up to your lash line, what we recommend is that you follow and just stay outside this bone. You can feel there's a little bone right there. It's where your eye socket is the layman's term, but staying just below there. But if you were to get a little bit up there, you're not going to hurt anything, but you are more likely to see some more irritation. So
Absolutely. Yeah. Thank you, Joe. And then we have one question from Shanna as well. And she says, what do you think of, Joe, you're going to have to tell me, skincare is maybe, that's why Joe's here today. She's kind of our resident expert on that, which is great. But what do you think of spirulactin for perimenopausal acne? And that's what her gynecologist prescribed her.
Well, you missed the prefix to the gynecologist.
The Kaiser gynecologist.
That's the problem I have with that. Don't get me started. Kaiser doesn't believe in HRT, and their doctors, it's like pulling teeth to get them to prescribe it, and they don't prescribe bioidentical HRT. So not that there's anything wrong with spironolactone, but I just have to put the Kaiser dig in there. Although we have educated a few. I've had some Kaiser patients, their doctors refused to give them HRT, and then they started with us, and then they went back to Kaiser, and they're like, oh, so I guess it does work, and then they were willing to write them for it. And I'm like, oh, another doctor educated. But anyway, I'll let you talk about the skin stuff.
I mean, I kind of like defer to you all as well, because this is on the medical lines. I have prescribed spironolactone back in the day. It's not a first line drug for acne. There are risks involved in taking that. There's a whole bunch of other things that you do first and foremost before you head over to spironolactone. But I can't speak because I never really used it for perimenopausal acne. It was mostly for acne rosacea, just acne rosacea that wouldn't respond to the typical things like the gentle cleansers, gentle products, mineral sunscreens, oral antibiotics, and things like that. So I can't really, this is a medical doctor.
I mean, the big thing is it's a what we call a potassium sparing diuretic. So if you've ever had issues with electrolyte balance, it can be an issue. If you have kidney problems, it can be an issue. But I have had more and more patients recently come to us on it. Mm-hmm. And the other thing we have to be careful of is that if somebody's already on spironolactone, we have to be careful about prescribing the DHEA because they can actually compete. And so that's something that we have to be cognizant of. But yeah.
I think it's more commonly used for hirsutism and PCOS for hair, right, unwanted hair growth. And it can help. It doesn't work that great, but it does work some. There's a lot better things. Again, it's generally not the first line thing. Well, I guess it's the cheap first line thing. You
and I have dogs coming in and out of the room a lot.
Hence the Kaiser doctor. But yeah, it's not the best thing. It works some, but it's not great. But I think that's a lot of why it's used as well.
And it looks like we had one question from Jamie as well about the face cream and whether it can be used around microneedling treatments with taking a few days off in that way.
Well, yeah, and I had alluded to that earlier. Yeah, if you're going to have a procedure, check with the person doing the procedure. They typically will have some instructions about what you can and cannot do prior to the procedure, and then post-care instructions as well. I've done microneedling before, and we always have people stop 3 to 5 days before, just because, again, it's an irritant, and microneedling is an irritating procedure. So just to sort of not cause a lot of irritation and make that recovery. Microneedling typically takes 2 to 3 days recovery time. Some people, it can be as long as 5 days. So if you're using a product like a tretinoin or retin-A type product right up until the time you have the procedure, it's probably going to be a little more ouchy than normal, even though you get numbing for that. But then your recovery time after can be extended as well. So just follow whoever's doing that procedure, assuming that you're going to a place where you're doing it at home. That's another story. I can't comment on that because I've never done or recommended at-home microneedling. But if you're doing it at a facility, aesthetics or dermatology or plastic surgery office, just check with them. They will be able to tell you exactly how soon in advance to stop it, and then when you can safely resume.
I got to say, just the name sounds irritating.
But microneedling, it's a great procedure. It's absolutely great procedure. Yeah, you have to be numbed for it. So
awesome. And it looks like we have one last question on Facebook from Tina. And she's just wondering if you've tried HRT in the past and have had any bleeding with clots, would you typically adjust the medication or have the patient stop it completely?
Well, I think that, there's a lot of different reasons that a woman could develop abnormal bleeding. And so I think we need a little bit more information in the context. I wouldn't necessarily adjust a dosage of a medication I'm going to prescribe based on somebody's history of taking a different medication in the past. I think that, I'm going to get your information as your doctor. I'm going to review your information, and I'm going to come up with your starting dose based on my own algorithm. And we can make adjustments from there.
That's great. Perfect. Well, that looks like that is all the questions that we have in the chat. But thank you all so much for your time as well. I know that those questions were very appreciated to be answered. And it's great for me too to hear a little bit about what you all have to say. So I really enjoyed that as well. But thank you all for anyone who's listening. Thank you for being here. And thank you all for being on the panel today on both sides. And I hope everyone has a great night and was able to learn something as well.
Absolutely. Thanks everybody for coming out.
Thank you, guys.
Yes.
I learned I need to wear face cream. Sunscreen.
Sunscreen, Dr. Green. I'm going to get you one day.
Have a good night, everyone.
Good
Bye.
night.
Thank you for joining the Menopause Hour, brought to you by Winona. Menopause care made easy. To learn more, find Winona at bywinona.com and on Instagram at bywinona. Want to have your questions answered next? Register for our upcoming live Q&A, linked in the show notes.